going on my name. There you go.
Let's get this over here. No, wait. No, let's just put it.
Yeah, there we go. You filled it the wrong way, but yeah.
COVID cuts. That's where we're at, folks. Lindsay says it's a little thin up there, but whatever. Minor issue. So very busy week since the last time I was on here, but lots of development. I have an enormous amount of information. I got 2 of these, but not all of it I'll deal with because we're going to try to keep things concise and deal with the important issues. So there is no question that it has been a stressful week as we try to wrap our heads around what's going on with High River. And over the weekend, as I was getting more and more numbers, and I'll shout out right now to the manager, Dale LaGrange, out at Cargill, who has been extremely transparent and connected with me as to the questions that I had as this was all coming together. And Dale was phoning me and texting me and everything just to make sure that I knew what was going on, so that I could try to wrap my head around what to do in town and trying to think about what we could possibly do to try to help this situation. And I'll be honest, through the weekend, and I was very nervous as to what the municipality could actually do to help this thing. But as we experienced through the flood, not having information and not knowing what to do and not being able to act on something is just not in our nature. It's very hard. We want to get at it. We want to try to fix it and try to help the situation. So it was up until Monday morning, I was very, very nervous as to where this was headed. But I got a phone call from Dr. Adam Weiss first thing Monday morning, and he started talking about what the doctors had started to discuss and what they wanted to try to put together. And he wanted my thoughts on where we could do this and everything else. So up until that point, I was very, very nervous. But after talking to Adam, and I started to feel much better that there was a plan in place as to how we could deal with this on a local level. And so Dr. Weiss, Dr. Chris Warner, who's the chief of staff over at the High River Hospital, we've been connected. Dr. Ron Gorshay is just another one that's I've stayed in very close contact with everything. Lise Brisbois-Bluin, who is our director of Alberta Health Services Rural, who's in town, connected with her, and PCN lead Stephanie Crichton, all these people. Terry Schall, who's an RN in town that's going to be helping in on this project, and Dr. Christine Kennedy, as well as this thing has come together. And I'll speak more about it. It's the Foothills COVID Hub that I'm talking about. As this thing's come together, there's so many people that are involved in it to get it put together quickly, and it's been fantastic. And our town staff with our CAO, Chris Prosser, has been on it from step one as to getting things in place to what we can assist with. And our emergency management manager, Peter Generu, he's been, all these people have been phenomenal to get it. And it's starting to give me a ton of comfort that, we can do this, we can handle it. And it's not going to be easy, and everybody's got a role to play in this, but there's no question we'll get through this. The primary goal of all of this is to keep this virus out of our long-term care centers and out of our hospital as much as we possibly can. So I'm going to speak more as to how this program is actually going to work, but I want to go first back to Cargill and speak specifically about Cargill. Number one, this is not a Cargill virus. This is not the time to be blaming Cargill for anything. This virus came into their staff from outside, just like it comes into every country, and where the thing all started. And if you're looking to put blame, and I'll be very clear on this and a little bit blunt, and some of you might not like it, but if you're going to take blame out or looking for somebody to blame, you got to go to the source. And China has to be held accountable for still allowing this practice of eating wild and exotic animals that we should not be consuming. So something has to change on a worldwide scale on that level, because we continue to make the same mistakes, and these viruses keep popping up out of that situation. So enough's enough. We have to find a way to stop that. That's beyond my scope of whatever, but let's not be blaming Cargill. Let's not be blaming any of their employees for this. We need to support these people. They live in our community. We need their assistance, and we need to support these folks so that they have the resources in order to be able to stay home and take care of themselves and their families. And these are not just Cargill employees that are there. Their family members are critical to our community as to, working in the businesses in High River and supporting those pieces. And they work in our long-term care centers and they care for our elderly. They're critical. We have to support them, and we have to give them the tools that they need to be able to do this. And again, I'll go into that plan in a few minutes here. But I also want to clear up some of the media that went out yesterday, and you bet I had to throw a grenade out there into the media to get some attention from Edmonton on what's going on. And I'll be honest, I do not like doing that. I do not like having to use public media shaming to get attention. I think it's not the right way to do things, but I guess sometimes today you got to do it. And so we got it out there, and we got attention. And so a couple of things that were brought up in that stuff was, number one, were my comments about some of Dr. Dina Hinshaw's comments. And I do not fault Dr. Hinshaw for this, but I started getting concerns from council members with what was said, and as well as residents with, how was in regards to her comment about the municipality is monitoring these individuals. And, we have no ability to do that. We have no interest in doing that, because those are privacy issues and everything else. And we don't have the resources to be going and monitoring people. That's their responsibility, and we expect them to take this seriously and do their monitoring. But I did get an answer back from Dr. Hinshaw's office yesterday, and she understands that the wording was not correct on that. And I'm not, like I said, I'm not going to fault her. She's in front of those cameras getting nailed with these questions, and not everything's perfect when it comes out. And that's just, we understand that, and I've been there. So another one to work through, but to clarify, no, the municipality is not monitoring these people. That's the role of our AHS, number one, and our doctors in town that are connected to these people. So that's their role. Another sensitive topic that I have to speak out about with my experience over the last few days is in regards to the politics that are going on with this thing. And High River quickly became an epicenter of this outbreak in this province. And I was trying to get a hold of officials within the Ministry of Health to get some support after I started talking with the doctors as to what we needed, and they were telling me what we need out of the Ministry of Health. And what really concerns me is, I was trying to go through the proper channels with our MLA, with Roger Reed, and Roger was doing everything in his power to get some connections made. It's very disturbing to me that at the end of the day, I was able to, through other channels that I triggered yesterday morning, that I was able to get connected with these folks in Edmonton, directly with the Ministry of Health, before our MLA was. That is deeply disturbing to me, and it's disturbing to me that our elected official in this town that's on the ground floor of this outbreak in this community, who is our elected representative with this government, could not get a call back to help those of us that are trying to deal with it, to get connection made with his own government. It's just, it's deeply disturbing to me, and if it bothers you, I'm telling you, emails need to go directly to the Premier of this province to flag this thing, because if our elected officials here, our representatives of this government, are not being heard, we need to kick some asses. It's just unbelievable. I'll leave that one alone. Okay, let's go into, everybody's got questions about the cases of COVID in High River. The number doesn't matter anymore. The number's big enough, and if you're looking for a number, the AHS website, the geospatial mapping, there's your number. So if you're looking for a number, that's it. Got to realize that the number that's on that website is old compared to what's actually on the ground in High River. So if you don't like the number that's on the website, there's more that's that day. So I'm not trying to make people panic, but you need the correct information, and you need to understand what reality is to make your own decisions as to how you are acting in this, and what where you're going, how you're doing things, how seriously you're taking this, because it's serious. You guys have been saying this since day one, that you got to take this seriously, and I've been trying to push it out there and get people to pay attention. But I'll be honest, even after everything came to light as to what was going on and coming into our community, and the numbers are growing over the weekend, and I'm in the grocery store on Tuesday, and 95% of the people in there, no mask, no gloves, it's just like every day. So, I can tell you what my concerns are. What you do with it is your responsibility, but the numbers are big enough now on the map that it doesn't change whether you double the number or not. How you're acting, it hasn't changed since day one. It should not be. So I'll get more into that. But when we start looking at, I'm going to flip that page. When we start looking at how we are acting and what we are doing, number one, extremely important that anyone that is a positive case, or anyone that is living with a positive case, or has been directly connected to a positive case without the proper PPE on, you need to be self-isolating right now. And that means staying at home and getting somebody to bring groceries to you and to your household. And there's means of doing that. Wild Rose Connections in High River, they are on Facebook. They're easy to find on the internet. You can get a hold of them. They have volunteers that are doing a fantastic job that will get all these things. You need prescriptions, you need groceries. They will support you. They are there for you. So that's critical. I also want to talk about employers, that if you have people working in your facility, regardless of whether they're showing symptoms or not, but if you have people working in your facilities that are connected to positive cases, they need to be home. They need to be isolated. Like I said, regardless of whether they're showing symptoms right now, we cannot have this in our general population. I go back to our number one concerns. We're trying to protect primarily, like the big one, is our long-term care centers and our High River Hospital. The High River Hospital second floor has 2 positive cases from residents on that second floor. I'll be clear about that and quell any rumors of bigger numbers, but that's the real numbers. So we've got that, and you can, the High River Hospital can contain that much better than our long-term care centers can. They're a little more open and loose, but they're doing a fantastic job, and it's not in those centers. So that's where I'm saying, if you got people that are connected to positive cases, they got to be home for 2 weeks right now. That's not Alberta Health Services or Alberta Health rules. That's our advice to our employers with what's going on in High River. So I've heard from a couple of businesses that have done that directly. They've done that before this had ever come out. They're recognizing it, and they've sent employees home that have relatives that are COVID positive. So they're ahead of it, and that's what we need to be doing. This is how we're going to get through this. Individuals, everybody that's watching this video or will be, or anybody that you're connecting with and talking to about what I'm saying, you must take accountability for your own actions. And I'll tell you, when I see the outrage on social media about the 7-Eleven closure on the weekend, my first question is, what are you doing in 7-Eleven? Just because a business is deemed essential does not mean there's anything essential in that business that you absolutely need right now. This is critical. So when I hear that, I went in and grabbed a Slurpee the other day, this is unbelievable that I didn't know about this. It's just like you have to take your own accountability. You have to assess for yourself. Is it essential that I go in and I need that Slurpee right now? It's not. We deliver water directly to your home, and you just open up a tap if you're thirsty and you grab a glass and you drink. It's simple. Costs you pennies. So that's where we're at, you guys, and we gotta just be so strong on this right now. And I will say, the communities around us, this is not just a High River thing. You gotta start paying attention to this. And I'll end that there, because we're frustrated with the response we're getting from others. So let's talk about the Foothills COVID Hub. This is the big piece these doctors are putting together, and this is a big deal, because our big worry was, how are we going to monitor this situation, and how are we going to know that these people are taken care of? How are we going to know that Alberta Health Services is taking care of these people? Because it's so big. This isn't just High River. This is across the province and across the country. So that was a big concern back over the weekend, is, where's the support coming from? And that's where this Foothills COVID Hub, so there's going to be 2 pieces to it that have come to light over the last couple of days. Number one, the doctors area. Right now, it's being planned that we're opening up the culture center to this use. And this is where the doctors can have direct contact with their patients. The town has nothing to do with monitoring. We don't want lists of people. We want nothing to do with that. That is not our role. That has to be done privately, respectfully, through the doctors and through Alberta Health Services. That's where the monitoring comes from, and that's what this COVID Hub will do. 90% of this can be done virtually, whether it's over the phone or over Skype, Zoom, GoToMeeting, FaceTime, all of this stuff, right? We got the means to do it. So that's where this allows the doctors the resources to be able to connect directly with these cases and provide them the support and the resources and the education, and to be able to stress how important it is to stay at home, but the doctors can take care of these people very well. So that's the first part of it. The second part of it is the doctors really wanted to get, right now the testing site is within the High River Hospital, has to be within an Alberta Health Services facility. Right now it's in the High River Hospital, and they wanted to get those, the sick people that were coming in to get tested, we want them out of the High River Hospital. It's too many going in there. We want to keep the hospital clean. So we were going to do it in conjunction with this culture center thing, but as of yesterday afternoon, after things got some attention, Alberta Health Services has stepped in. High River is priority number one in the Calgary region right now, and they are setting up a separate testing site that'll be separate from the culture center in one of their other buildings they own in High River. And those people that are feeling symptoms can go there to get tested, which is safe out of our other areas. It's fantastic. That also allows our doctors to not be swabbing people, but focusing on the support mechanisms and the monitoring of those that are ill. So thanks to Alberta Health Services for putting a priority on this, because it happened quick and it's happening now, and it should be up running with the testing center either by tomorrow afternoon or Monday is what I'm being told from this morning. So a ton of people involved in this, and you know, I've made my thank yous before. I'm not going to continue to go on in this. So those are the big pieces that, and I go back to, you know, you look at what businesses are doing, and I get a lot of reports as to, oh, I was in this business and nobody was wearing gloves or anything else, and blah, blah, blah. You got to take your own individual accountability first. That is number one. Assess whether you need to be in that business, and if you go in that business, what are you doing? Are you wearing gloves? Are you wearing a mask? I was in the grocery store with a full respirator on the other day. I'm not screwing around. I can't get sick. This is very bad for me if I get sick, but on a number of levels. But I was looked at like I was from another planet, and I don't care. Couldn't care less how I look. I can't get sick. And the other thing is, when I wear that respirator, everybody stays away from me. So it's fantastic and very freeing to have it on. But it's critical. Like, your own accountability and your own responsibility, and you assess what's essential or not. Okay, normal business. I'll just finish off on a few things on that. Our social distancing, our hand washing, it's just priority number one. It's easy to do. It's not that big a deal. Wash your hands, sanitize your hands. Just it's simple, and you can do it, and let's just get at it. Flood preparedness, that's another thing the town's still working on. Bags on 12th Avenue, they will not be removed until the new berm is functionally complete. So in preparing for that, you will see action taking place on 12th Avenue to replace the broken bags and put the new ones in, so we're protected for this spring. So regardless of COVID, we are focused on the flood as well, flood concerns, as to making sure that we're protected. So save your comments on the bags, not whatever. We got bigger fish to fry right now, and I'll just please respect those that are working around there. They're doing things to keep us protected. So still say it. I know media can get pretty overwhelming with reading all this stuff, and especially with what's going on now, but take a break from it. And Lindsay is very good at hiding my phone just so that I can keep my hands off it. If it's there, you look at it, it's just becomes very annoying, but it's very hard to do. So give yourself a couple hours a day at least to just take a breath on it. Council and what we're doing. So special council meetings, we're planning one for, right now it's planned for Tuesday, to discuss a few things, mostly about our bigger projects with Southwest Berm and Center Street, but they will be streamed live on YouTube. So you can, if you're interested and you want to sit in on that, you're more than just keep watching for those notifications that Michelle and Donna will put out on social media as to when and how you access those things. So all of our essential services in town, water, wastewater, fire, police, garbage, recycling, all of that stuff is still fully operational. I will say the High River Hospital, I talked to Lise this morning and she assured me that their caseload coming into the ER and these areas is lower than normal, so they've got lots of capacity available. They are not overwhelmed at all. They're handling this situation very, very well, and so we're in good hands over at the hospital, just to put everybody's mind at ease as to what's happening over there. So thank you again to all our town staff with everything they're doing to keep us going along normally and kind of normally. There's no such thing as normal right now because it's not normal. So, but trying to keep our services happening for us so that we can at least get through this as easy as possible. So I'm going to end that there. I don't think I have anything else. You got questions, Michelle?
Two questions. The first one, from a resident that just moved here. They're interested in supporting local business during this time and wondering if there's like a main resource that they can go to find out what businesses are doing, how she can support those businesses. Is there anything like that right now?
Yeah, so the question is about how can I support local businesses right now? And you know, there's lots of different ways of doing that. And you know, there's some of these businesses are doing home delivery services and everything. So if you need something, you can phone them and see if they're doing that. Some of the businesses are just shut down, and the biggest thing they need is when the restrictions come off that we're in there and we're back supporting them. That's a big deal. But through one initiative the town is putting together right now is a little bit of a business hub where we can help share that kind of information, and the businesses can tell us what we're doing or what they're doing, and we can have a hub. So keep watching for that. But you know, if there's a business that you want to support, just give them a phone call, see if they're open and how you might be able to support them, whether it's a restaurant doing delivery or takeout service. That's usually a sit-down restaurant. Some of them are still doing that. But again, I go back to health safety is priority number one, and you just, that's number one, is to determine whether that is essential or not right now. So I don't want to take away from any business, but health priority is absolutely number one in this town right now. So take accountability for your own actions.
And the second question is from a local business owner. They're wondering if the town is working on a return to society, return to business process, and how long something like that might take.
Yeah, so so the question is about basically economic recovery after this and what steps we're taking to get economic recovery back going. And we've been through this before with the flood, and you know, there's not a lot that the actual municipality can actually do to make people come into your business. That's the only way your business gets going again, is that people support it and they get in there and do it. We've done little things with, you know, keeping the tax increases low and, you know, your utilities and these kinds of things. But part of what Melissa and our ECDev department is working on is providing those support mechanisms to these businesses so that they have the information and the resources that are available to them, whether it be through federal grants and loans and all this kind of stuff. You got to assess whether that's part of yours. But, you know, it's been a interesting thing that I've learned a lot about with ECDev and municipalities. And at the end of the day, a lot of municipalities pay lip service to this stuff that, you know, saying that it's just lip service, because at the end of the day, your business, my business, is my responsibility. I want very limited municipal involvement in my business. Make sure the water and the sewer work in my place and stay out of it. And your business is your responsibility. That's number one. It's not for any level of government to fix for you. So there are amazing programs that are coming out to help your employees and wage subsidies and all this kind of stuff. That's where government fits in. But economic recovery coming out of this thing, and it's, and I'm not gonna sit here and pay lip service to it. I'm gonna tell you exactly what the deal is, and that's how you got to make decisions for yourself. Because what I find is that a lot of times businesses sit there and wait for government to help them, and that's not how we work as entrepreneurs. So we'll do what we can with the pieces that we're in control of, but lowering taxes, all this kind of stuff, is not a dictator as to whether their business survives or not. So those are the kinds of things that we're in control of. But the support mechanisms, and that's what our ECDEV department is working on, and those resources, that's where we can help, and just kind of having a central spot where you can find that information. That's where an ECDEV department actually has some actual action on the ground, and we can do it. So I do know Angie Greneveld is doing a lot of work on her own. That Angie was with us through the flood, and if you look her up on Facebook, there's a lot of information that she's sharing with businesses, but and a lot of experience that she has through this. So, but a support program, that's where the municipality falls into play. What actually goes on within your businesses, I want my own accountability with what's going on in here. Nobody else's. It's my responsibility. So, tell you straight up how I feel about that.
One more came through about the Southwest berm. Is it still planned to be built this year?
Yeah, the Southwest berm is still, we're flying. That's part of the meeting of our next special council meeting, is to get that tender finalized and get that awarded. And as we do that, it's time to rock and roll and foot to the floor, getting that thing going. So Southwest berm is absolutely still happening. So that's it for questions. You know how to get a hold of me. You can email me. Everybody's messaging me on Facebook, and I'm trying to give you some answers, but I'm not the person in front of the camera that's going to give you some scripted answer or anything. I'll give you the truth, and I'll give you the reality. So just be prepared for that, I guess. Have fun. Rock and roll. Bye-bye.